The other day, I was working in the hospital when I got a call from the alcohol detox center in town asking if I could help find shelter for a man who had none. I asked a few questions to make sure he was medically stable, and then I made a quick call to a motel down the road. Within minutes, he had a reservation for his own room with a clean bed, private bathroom, and 3 hot meals a day at no charge to him. Although calls like this have actually become pretty routine these days, it bears remembering that a few months ago, I would have had little to offer this vulnerable patient. That all changed early in the pandemic when two of my amazing colleagues foresaw that coronavirus disease would disproportionately affect people experiencing homelessness in our community. And they started working tirelessly with state and local authorities to find ways to keep these folks safe. Their effort came to fruition in the form of a partnership with local hotels who were willing to feed and shelter patients with COVID or those at risk of the disease. Funding from the state paid for the rooms and food, and these local hospitality businesses provided a critical service while benefiting from a steady alternate income stream during this time of severe economic uncertainty. Months later, the program has provided shelter for over 800 patients, including those who may have a home but don't have the option to self-isolate from family members who share their living space. I have no doubt that this has prevented countless cases in our area and eased the burden of the pandemic on our under-resourced rural health system. For me, the most notable success stories of the program are those that actually have nothing to do with COVID. For some patients, a simple hotel room has provided the stable foundation they need to finally get treatment for their substance use disorder, or learn how to manage a complex medication regimen for their previously uncontrolled diabetes. One hotel patient recently told me that she felt happy for the first time in her adult life. I don't know how long the funding for this program is going to last, but for now, these stories give me tremendous hope, and they offer a glimpse into a different kind of health system in which we have the resources to meet our patients' most fundamental needs and honor their dignity as fellow human beings.